was my second day in the hospital. I think the highlight of my day was when we were doing like our daily huddle and our ER pharmacist was like, I had this really interesting thing today. And she said that there was a lady in the ED and she was like, I really need to talk to the pharmacist. Like, where's the pharmacist? I need to see the pharmacist. I was like, someone coming into the ER like requesting a pharmacist, amazing, perfect, 10 out of 10. And I was like, what did she like ask you? And she basically just asked her like, am I gonna be okay? She was like, I only trust pharmacists. I've never heard that before, but girly pop, wow. Yeah, if you go to like the ED, yeah, there are pharmacists there. You can just ask for one. We're all over the place, in the ICU, everywhere, all over the floors, sometimes hiding in the inpatient pharmacy. But yeah, you can talk to a pharmacist if you need to. So I had a basic tour of the hospital, the different units. And then I was like, I want to see what's in the little like code kits. Apparently for like code stroke and stuff like that, they have like little, like, I shit you not, these are like fishing, like not there are tackle boxes. Some of them are tackle boxes. Some of them are like what you would put like bobbers and like weights and hooks in, but they're like split and they have like little different drugs in it. It had 2 neuromuscular junction blockers. We had succinylcholine and rocuronium, and then it had 1 IV anesthetic or general anesthetic. It was etomidate. So I was like, interesting. So I was looking at them. I have to make like a little study chart when I get home or like another day with like the doses and stuff like that. I'm gonna study that when I have time. I guess all 3 of those can be given as a push. I'll mention you only use one of the NM blockers. There are different types of blockers. So we have a depolarizing and a non-depolarizing, but rocuronium has a longer duration than succinylcholine. Also important to know, I mentioned in my other video, always have in mind what you want your continuous sedation to be, because the etomidate is gonna wear off soon, like 10 minutes. Rock's gonna last longer, like 30 plus minutes. Succinylcholine can also cause some hyperkalemia, but I think we usually go for rock, I guess. But then I also looked at the stroke kit. The stroke kit's gonna have TNcase, sterile water, and a syringe. TNcase is your fibrinolytic, your tissue plasminogen activator, or TPA. This is for ischemic stroke. If you give it to someone who has a hemorrhagic, it will probably kill them. The dose for stroke is 0.25 mg per kg, max dose 25 milligrams. So we gotta take 10 mils of the water and put it in the vial as 50 milligrams in the vial. So you're only gonna use half that vial, up to half that vial, 5 mils. It's 5 mg per mil. And then I also glanced at their cath lab STEMI kit, their C-section kit, and then their like general anesthesia kit. It's been a minute since I've seen like a lot of these drugs in my notes. The neuromuscular junction blockers and the IV like general anesthetics I learned in 2019. It was in my introduction of principles of drug action course. This is a 4-course series. And then the following year I learned about like anticoagulants and stuff, clot busters and stuff like that. So it's interesting to see like what they look like in the little kits. But when I have time, I'm gonna make like sheets at home with like each medication in it and like what is like a normal dose and like side effects, contraindications, stuff like that. I think I found a special interest in the hospital. I already knew I kind of liked emergency medicine and critical care, but after my first day when like we were going through like the crash cart for like codes, I was like, yeah, I think that and tox, I think those are my little things that I like to do. I don't like biologics, and chemo is kind of a lot. Don't ask me about MS or lupus, autoimmune stuff. But yeah, I'm having a good time. I kind of don't want to go back to retail ever again.